talking about the midbrain. Sensory root is connected anteriorly with the trigeminal ganglion, which are 3 division, thalamic division, maxillary division, and mandibular division. And motor root, all the fibers go along the mandibular division. So look here, this is pontomedullary junction. Or we can say here it is pontomedullary junction. And what is this structure behind it, posterior to it? Cerebellum. And we can draw the cerebellum on the back of it, a structure like, yes please, is it clear? Now, we have to see the relationship, that what are the exact point from where the sixth nerve exits out. What is the name of the sixth nerve? Yes please? Abducent nerve, which is also concerned with the movement of the eyeball. It innervates the lateral rectus, right? It abducts the eyeball. Now, where exactly the sixth nerve is attached with the central nervous system? Actually, it exits. Now, this area where pons and medulla are meeting and cerebellum is covering from the side, this area is called pontocerebellar angle, right? Look, this point, right, these points are called pontocerebellar angle. Is that right? Now, sixth nerve exits exactly at this point. This is sixth nerve, right? This is exiting at this point. Just lateral to that, there is exit point for or attachment of seventh nerve, and more lateral to that, there is exit point for the eighth nerve. So 6th, 7th and 8th, they are moving out at the junction of pons and medulla and cerebellum, right? And 6th is exiting out from most anterior aspect, anteromedial side. Lateral to the 6th abducent, there is exit point of the 7th nerve. And more lateral to that, there is exit point of the 8th nerve. Is that right? Now, in the lateral view, now we must show the same thing in the lateral view as well, right? So we can see it here. Which nerve is coming out from here? 6th nerve. What should be here? 7th nerve. And what should be here? 8th nerve, right? So, 6th is abducent nerve, 7th is, yes please, facial nerve, and 8th is, yes please, Vestibulocochlear nerve. So next time we can say that 6th, 7th, 8th nerves, they are exiting from the brain stem at pontomedullary junction, and as you move from medial to lateral side, it converts into pontocerebellar angle, right? The medial one, most medial is 6th nerve, lateral to that, what is exiting out? 7th nerve, and very laterally, what is coming out? 8th nerve. So, abducent, facial, and vestibulocochlear nerve. Is that clear? So these are exact attachment up to the 8th nerve. Is there any question up to here? There is no question. Okay. Now we have to see attachment of the remaining 4 nerves which are with the medulla. Right? Remaining 4th nerve, how they are attached with the medulla. When we are talking about, okay, let me draw it again. Let's draw medulla a little bit larger so that we can see it more clearly. area, there are two swellings related with the medulla. Just on the side of the median, this area is called pyramid, right? Pyramid. And on the sides of the pyramid, there are olive. And on the side of all these structures, what is here? Yes? Cerebellum. Is that right? Now, this is olive. What was the nerve here? Eighth nerve. Just below the eighth nerve and behind the olive. You know, this sulcus is called post-olivary sulcus. What is the name of this sulcus? Post-olivary sulcus. And this one between the pyramid and the olive, this is called pre-olivary sulcus. Right? The same way we can draw here. If this is olive present over here, right? So this must be, yes, pre-olivary sulcus, and here should be post-olivary sulcus. This is pre-olivary sulcus, and here it is post-olivary sulcus. Right. Now, pre-olivary sulcus is anteromedial to the olive, and post-olivary sulcus is posterolateral to the olive. Now, what really happens? Ninth nerve, right? 10th nerve, and cranial part of 11th nerve, right? Okay, let me change the color so that you can see it more clearly. This is pre-olivary sulcus, and here you can say there is post-olivary sulcus, right? Now, ninth nerve, rootlets exert from this point, right? Between the olive and the post-olivary sulcus. 10th nerve rootlets also exert just from the same sulcus, but just inferior to the ninth nerve. Ninth nerve is glossopharyngeal, 10th nerve is vagus, and then here is cranial part of 11th nerve. Here it is, cranial part of 11th nerve, and here there is exit of spinal part of 11th nerve, and now here is which part? Spinal part of 11th nerve. Its rootlets make a bundle which is moving upward through the foramen magnum, and it meets with the cranial part of 11th nerve, right? Now, and here is 10th nerve, and here is 9th nerve. 9th, 10th, cranial part of 11th, and spinal part of 11th. 11th, cranial part, and 11th, spinal part. Right? The point which I want to highlight, that 9th nerve, 10th nerve, and 11th nerve, they are attached with the medulla just on the posterolateral aspect of, yes please, posterolateral aspect of olive, right? So we can say that these are basically in vertical line emerging in the post-olivary sulcus. Is that right? Now, if you want to really see in this diagram how these 9th, 10th and 11th are emerging, again, this is point which is post-olivary sulcus, and here is the line which is post-olivary sulcus. So, 9th gray matter which is concerned with the sensory system, the alar plates. And in the front, These are the grey matter, interior horn, which are derived from basal plates. And these are mainly concerned with which system? Motor system. So we can say that in the spinal cord, anteromedially, there is motor grey matter, right? And posterolaterally, there is sensory grey matter. And then visceral activity. Now first of all, we'll talk about the fibers. Look here. The fibers, motor fibers, look now, which are going directly from here to the muscles. These are called efferent fibers. And these fibers which are going to the skeletal muscles, these are called general somatic efferents. General somatic efferent. Right? Then, for visceral system, for different viscera, this may be any viscera, maybe GIT or any. Now look, this green pathway which is present at the junction of blue, red and blue, right? This is a small piece of grey matter which is also called lateral grey matter. Fibers from here are going to the viscera, right? And they are concerned with stimulation of smooth muscles and also concerned with the stimulation of glands. So this innervation which is going for smooth muscle and going for the glands, this is called general visceral efferents. The spinal cord has two type of, you can say, outflow. Okay, let me draw it a larger so that you should be more clear about it. Here is spinal cord. It means throughout the brain stem, motor nuclei must be present medially, generally speaking, and sensory nuclei must be present laterally. Another point which was important, that this grey matter, as it is moving like a column upward, right? What really happens to this grey matter is that because the sensory and motor decussations, this grey matter is fragmented into small isolated pieces of grey matter which are called cranial nerve nuclei. Again, let me repeat it, that in the brainstem, motor grey matter and sensory grey matter. Number one, motor grey matter should be centralized and sensory grey matter should be on the flanks. Number two, what really happens that when the major crossing of the motor system, like in the pyramidal tract and their sensory systems, right, when they're crossing in the brainstem, these columns of the grey matter, they are scattered into smaller pieces, and these small pieces of motor grey matter as well as sensory grey matter which are placed within the brainstem, they are called cranial nerve nuclei. It means cranial nerve nuclei can be motor as well as they can be sensory. Is that right? Any question up to here? Now, one thing which we should see from here, that actually this should be somatic motor in the center. What should be here? What should be here? Nuclei. Most medial. This should be general somatic efferent, or general somatic efferent column should be central. This column should be centralmost. On the side of that, what is there? General visceral efferent. Right? There is general visceral efferent and general visceral efferents. Is that right? One thing more, that in the brainstem, there are additional motor fiber. I told you that in the lower part of the body, right, in the lower part of the body, it's enough to have general somatic efferent with that general visceral efferents. Is that right? But when we talk about head and neck, right, of course, we have to have general somatic efferents. We have to have general visceral efferent. But in addition to that, there are some structures, motor structures, which are developing from the branchial arches. And for those structures, we have to develop another column of gray matter, which is going to supply the branchiomotor fibers. So it means there should be an additional column of gray matter here. There should be an additional column of gray matter here. This column of gray matter, which is additionally present in the brainstem but not present in the spinal cord, this is called branchiomotor outflow. What is it? Branchiomotor outflow, or we can say these are special visceral efferents. Special visceral efferents. Is it clear? These are called special visceral efferent column. Right? Now, first I will concentrate on the motor nuclei in the brainstem. Then I will switch towards the concept of sensory nuclei. Now, how many columns of motor nuclei should be there? Yes, please. There should be on each side, if this is the, of course, median area, right, on both sides there should general somatic midbrain. It starts gray matter of the brain stem. Now, look, after this was the general somatic efferents, which are supplying, this column is supplying 3rd, 4th and 6th for the, yes please, extra ocular muscles, and then 12th for the muscles of the tongue. Then we come to the next column. What is this column? General visceral efferent. And this column will have its own representation. Now, this column should be laterally present. Is that right? Lateral to this one. And it should have its own presentations. You know what are the presentations here? Here is, yes, with the 3rd nerve, main nucleus, just lateral to this, there is a rocket-shaped nucleus, and this is parasympathetic outflow, right? You know what is this nucleus? Yes, please. Adinger-Westphal nucleus, which is concerned with the parasympathetic supply through the ciliary ganglion, to the pupiloconstrictor muscle as well as to ciliaris, right? So this is just like general, yes please, what is it? General visceral efferents. General visceral efferents, right? After this, the next nucleus which presents in the same column is somewhere near here, yes. And this nucleus is going to supply, it has two halves, upper half and lower half. Upper half is also called lacrimatory nucleus. Lacrimatory nucleus, right? Lacrimatory nucleus, and just under it, but continuous with it, is superior salivatory nucleus. Salivatory nucleus. Now, these two nuclei are, or you can say one nucleus with two parts, are which they are part of which column? General visceral efferents. Because they are part of the general visceral efferent, right? Upper are going to the lacrimal gland, as this was going through which? Yes. What was this? Ciliary ganglia. And what should be this lacrimatory fiber? They should go through which ganglion? Pterygopalatine? Pterygopalatine ganglion. Right? The superior salivatory fibers should go through which ganglion? Yes, please. This is submandibular ganglion and lingual ganglion, mainly submandibular ganglion. Then, under it, in the lowermost part of the pons, there is one more member of this group. This is, yes please, inferior salivatory nucleus, and its fibers through the aortic ganglion, they are going to parotid gland. They are going to parotid gland. Now, this was another column, and of course, the most important member of this column. The most important member of this column is dorsal nucleus of vagus. Most important member of this column is dorsal nucleus of vagus. Have you heard of it? The dorsal nucleus of vagus has two types of fibers. This part of the nucleus which I have drawn here, this consists of preganglionic parasympathetic outflow. You know, vagus nerve carries a lot of parasympathetic outflow for glands in the larynx, pharynx, esophagus, trachea, respiratory system, cardiac parasympathetic supply, stomach, right? Small gut, then ascending colon, and up to transverse colon. All parasympathetic supply is going from the dorsal nucleus of vagus, right? So we can say that there is a general visceral efferent column within the brain stem, and nuclei which represent this vertical column are Edinger-Westphal nucleus, which sends this fiber through which nerve? Third nerve, Edinger-Westphal nucleus. Then there is superior, you can say salivatory and lacrimatory nucleus, right? And lacrimatory nucleus sends this fiber, and superior salivatory nucleus, both of them send its fiber through the 7th nerve. Then inferior salivatory nucleus, which connects its fiber through the 9th glossopharyngeal nerve. Then dorsal nucleus of vagus, which gives its fiber parasympathetic outflow to which fibers? Which nerve? Vagus nerve, of course, right? So what we have seen really here is two columns, right? We have discussed general somatic efferent column. We have discussed general visceral efferent column, right? Now let's recap. In general somatic efferent column, there is third nerve nucleus, fourth nerve nucleus. Is that right? Then we come to general visceral efferent path column. In this case, it is represented by four nuclei. Superior most is with the third nerve nucleus called Edinger-Westphal, which gives parasympathetic outflow for the eyeball, right? For the sphincter pupillae and ciliaris through the ciliary ganglion. Then at lower pons, it has lacrimatory nucleus and superior salivatory nucleus. This nuclear fiber goes with the 7th nerve, and through the 7th nerve, some fibers through the pterygopalatine ganglion, they go to the lacrimal apparatus. Some fibers through the pterygopalatine ganglia go to the hard palate and nasal cavity secretions. And some fibers through the, again, 7th nerve, and eventually through the submandibular ganglion, go to the submandibular gland and to the sublingual gland. Then below this, the next nucleus in the column is inferior salivatory nucleus, which provides fiber to which nerve? Inferior salivatory nucleus. It provides fiber to the, 9th nerve, glossopharyngeal, and they will go through the aortic ganglion, and through the aortic ganglion, of course, you know that these fibers will be provided to the, yes please, parotid gland. Then we come to the lowermost. What is this one? Dorsal nucleus of the vagus, which is the most important and heaviest nucleus and largest nucleus in this column, right? This nucleus, this particular nucleus provides a very big amount of big number of fibers, parasympathetic preganglionic fibers to the vagus nerve, and that vagus nerve is then giving these fibers to the larynx, pharynx, trachea, lungs, right? Then to the cardiac tissue and to the GIT and allied glands, right? From, you can say, all the small GIT, even you can say cecum and ascending colon and transverse colon up to somatic. Is that right? Now, when we keep these columns in our mind, laterally, in the same way, head and neck, there are four column. What you really see in these columns is that visceral sensations are medially placed and somatic sensations are laterally placed. And as compared to spinal cord, there is addition of special visceral as well as there is addition of special somatic. Is that right? Now, when we keep these columns in our mind, when we keep this column system in our mind, right, then we can draw the individual nuclei related with them, right? For example, when we talk about general visceral afferent, actually there's a nucleus here, a very, very important nucleus just on the side of the dorsal nucleus of vagus, right? And this nucleus has four parts: superior part, inferior part, and this is superior part of that, this is inferior part of that nucleus, this is middle lateral, and this is middle medial, right? Now this nucleus, attention please, presents these two columns. Column of general visceral afferent as well as column of special visceral afferent. This is a fused nucleus of two. Actually its uppermost part is receiving the taste fibers. The uppermost part is receiving taste fiber. This is for the taste. Taste, gustatory sensation. Now, taste fibers come through fifth. Special somatic afferents, right? And this is basically vestibular nuclear complex. Why you call it vestibular nuclear complex? There is superior part and there is medial part of the nucleus, there is lateral nucleus and inferior nucleus. In the same way, it is divided like this: the superior vestibular nucleus, medial vestibular nucleus, lateral vestibular nucleus, and there is inferior vestibular nucleus, right? So this is laterally present at the pontomedullary junction, right? And they are connected with the vestibular part of the vestibulocochlear nerve. Is that clear? Now we come to the last part, which is that part, cochlear. So cochlear, there is a ventral cochlear nucleus and there is dorsal cochlear nucleus. So some is anteriorly present, other is posteriorly present. In the same way, ventral cochlear nucleus and dorsal cochlear nucleus, which are most laterally present, and they are concerned with the reception of auditory information. They are concerned with the reception of auditory information. Is it clear to everyone? Ventral and dorsal cochlear nuclei. Ventral and dorsal cochlear nuclei. Any question up to here? Okay, this puts in perspective all the important motor and sensory nuclei present within the brain stem. Now the next job is that we should connect these nuclei with cranial nerves, and we must see which cranial nerves are connected with which nuclei. Now, as far as upper nuclei are concerned, story is simple. For example, third nerve nucleus is feeding only third cranial nerve. But when you come to the nerve, the lower nuclei, there's funny thing happening there. One nerve, like vagus, may be connected with the multiple nuclei here, and one nucleus may be feeding the multiple nerves, right? So if you're ready for that, we'll go for that job. Is there any question before we go? Now we have to connect these nuclei with different cranial nerves. Let's suppose here is third cranial nerve. This is third cranial nerve. So it must be oculomotor. It receives the fiber from parasympathetic nucleus, Adinger-Westphal, and it also receives fiber from main nucleus of oculomotor nerve. These are the fibers, parasympathetic fibers, which are going through the ciliary ganglion to the constrictor pupillae, and they are also going towards ciliary body. And these are the fibers which are going to extraocular muscles, all extraocular muscles except lateral rectus and superior oblique. The easiest nerve to connect is fourth nerve. This is connected only with one nucleus of its own, and it goes backward. You remember that it emerges from the back of the central nervous system, and this fourth cranial nerve, right, it is having only general somatic motor fibers for superior oblique muscle. Now we come to the fifth nerve, but before that it's better to connect the sixth. Sixth nerve is like this, and this is going for abducent. Okay, let me draw it a little bit different way, just to... This is the sixth nerve, right? Now the fifth is left. Now you know fifth has a sensory root. This was the trigeminal ganglion, and here it was which divisions? Ophthalmic division, yes. Maxillary division, and there is mandibular division. Is that right? Now fibers of the fifth, proprioceptive fiber, divert upward. Proprioceptive fibers are diverted upward to the mesencephalic nucleus. Fine touch sensation fibers are coming to the pontine, and then pain and temperature fibers, they are going downward. This is the fifth nerve connection. Now we are left with the seventh nerve. Now you have to be careful. It's a very important nerve with very important connections. This is the facial nerve. Facial nerve. Now first of all, it has to take fibers from the seventh nerve nuclear fibers, move around the sixth nerve nucleus, and then these fibers are going to the facial. These are fibers going to the muscles of facial expression, right, along with that to stapedius and mylohyoid and anterior belly of digastric, right? Seventh nerve. Now seventh nerve has other fibers. It has lacrimatory fibers. Lacrimatory fibers are also joining the seventh nerve here, and they will go through pterygopalatine ganglion for lacrimation. Then they have salivatory fibers, and salivatory fibers also go from superior salivatory nucleus, and they are passing through submandibular ganglion, submandibular gland, as well as to the sublingual gland. Then seventh nerve brings seventh nerve is bringing afferent fibers from the taste from anterior 2/3 of the tongue. taste fibers from anterior 2/3 of the tongue through chorda tympani. They come to the seventh nerve, and these taste fibers will pass through the seventh nerve, and they will be connected to, what is this destination? Nucleus of Tractus solitarius. Nucleus of Tractus solitarius. Then, from external ear, and tympanic cavity, seventh nerve has some general somatic of touch pin temperature, and these fibers must end up with what? Spinal nucleus of trigeminal. So it means trigeminal nucleus is not only for trigeminal nucleus. Trigeminal nuclear system is collecting the information from trigeminal nerve as well as from seventh nerve, auricular information even from the ninth nerve, auricular information even from the 10th nerve, auricular information. Now, these are the main fibers of the seventh nerve. Now we come to the eighth nerve. There we should be thankful to the nature. Things are too easy. Eighth nerve, which is vestibulocochlear nerve. In the eighth nerve, of course, these are the vestibular fibers, right? And here these are, yes, cochlear fibers. So we can say from the eighth nerve, cochlear fibers are connected with the cochlear nuclei, and vestibular fibers are connected with the vestibular nuclei. Of course, they are afferents. Right? Now we are left with which nerve? Ninth nerve. Right? Semicircular canal, and this is left semicircular canal. While I rotate my head rightward, rotate like this. So it means the rotation is going in this direction, and here this is rotation in that direction. Yes. Now, how this rotation will produce signals here? How this rotation will produce signal here? Actually, there is a special structure here. There is collection of the sensory cells. So in this case, I will show that, yes, I will show here, copula is deflected like this. Cranial nerve, it is sixth cranial nerve, and depolarizes the hair cell, that increases the rate of action potential, it increases the frequency of action potential in the right vestibular nerve. Now, these fibers will go and get connected with the vestibular nuclei, and here is right vestibular nuclear complex. Okay, let me draw it. This is right vestibular nuclear complex, and here is left vestibular nuclear complex. It is present at pontomedullary junction in the brainstem. Now what really happens? That these fibers get connected with the medial vestibular nucleus. This is medial vestibular nucleus, this is superior vestibular nucleus, this is lateral vestibular nucleus, this is inferior vestibular nucleus. For vestibulo-ocular reflex, for horizontal conjugate movement, the main vestibular nucleus is medial vestibular nucleus. So what we said, that right vestibular nerves was stimulated, increased action potential go to what is this? Right medial vestibular nucleus. Now medial vestibular nucleus is connected with the abducent nucleus, right? Let me show you. Here is sixth nerve nucleus, right? And here is also sixth nerve nucleus. Okay? And here is third nerve nucleus, and here is third nerve nucleus, right? And let me show you, this is the midbrain, and here it is pons. Let me draw it more clearly. This is third nerve nucleus. Of course, where is it? In the midbrain, okay? In the midbrain. So here is your midbrain and here is your pons. Okay. Now, when rotation to the right side, yes, fluid move in the right, leftward, stimulate, deflected towards the kinocilium, in the right semicircular canal in the cristae, ampullaris is stimulated, frequency of action potential in right vestibular nerve is increased, the stimulate, yes, medial vestibular nucleus, medial vestibular nucleus on the right side is cross-connected with the, yes, it is cross-connected with the abducent nucleus, right, on the left side. Now from this abducent nucleus, from the nucleus of abducens, some fiber directly go to sixth cranial nerve, it is sixth cranial nerve, and abducent nerve, and stimulate the lateral rectus, ipsilateral. And some other fibers act as interneurons. They are also stimulated simultaneously, right? Yes. Interneurons, and these interneurons from the sixth nerve nucleus or abducens nucleus, they exit and go contralaterally and ascend upward and go to the, what is this? Oculomotor nerve nucleus. And from the oculomotor nerve nucleus, these fibers stimulate, what are these? The fibers from the oculomotor nerve, the fibers which are going to the medial rectus on right side. So what really happens? Now listen very carefully. Whole connection. Again, you move the head, rotate the head, rightward. Now I will show. I rotate the head, rightward. Right? Then cristae ampullaris is stimulated on right ear. That stimulates the medial rectus on right vestibular medial nucleus. It stimulates the medial nucleus of right vestibular nuclear complex. And this medial rectus, medial nucleus, not rectus. This medial nucleus stimulate which nucleus? Left abducent. And left abducens, number one, directly stimulate the left lateral rectus through the sixth nerve, and through the interneurons stimulate right oculomotor nerve to stimulate the medial rectus of right eye. When these two muscles are stimulated, what will happen? Eyes will deviate to the left side. What will really happen? That I will show like this. Then head.
Are concerned with angular movement and acceleration, whereas macula are concerned with linear movement and acceleration. Information from the vestibular sensory organs follows the vestibulocochlear nerve, CN8, to reach the brainstem. Let's trace the pathway. The first autoneuron is found in the vestibular ganglion, also called Scarpa's ganglion. From there, synapses connect to the vestibular nuclei. These are the superior, lateral, medial, and inferior nuclei. Neural signals from vestibular nuclei make numerous important connections. These include ascending connections to the abducens, trochlear, and oculomotor nuclei and the thalamus, projections to the cerebellum, and descending connections to the spinal cord. The vestibular system is involved in a number of important reflexes. Abducens, trochlear, and oculomotor nuclei are involved in the vestibulo-ocular reflex, VOR. Connections to the cerebellum participate in vestibulocerebellar reflexes, and descending connections participate in vestibulospinal reflexes. Instant neuro!
Medial vestibulospinal tract will control mainly the muscles of our head and neck. our lateral VST will control mainly muscles of our legs. Lateral to our legs. Both with the goal in maintaining our posture, maintaining our eyes horizontal. So let's have a look at our medial vestibulospinal tract. Obviously, we start in our medial vestibular nuclei. Interesting part of this is that it will project bilaterally, meaning on both sides of the body, down to our upper cervical spine.
Which goes to vestibulocerebellum, and two efferent tracts, and they end in spinal cord. We'll be learning about them in detail. The efferent tract is vestibulocerebellar tract, and the efferent tracts are, the first one is the reverse of this, cerebellovestibular tract, and the next one is fastigiobulbar tract. We'll try to simplify this by making a flow chart, and then we'll see the diagram. So let's see now the efferent tract. Very simple. It begins from the vestibular nucleus. So it begins from the vestibular nucleus, and then it passes through the inferior cerebellar peduncle of the same side and ends in the cerebellar nuclei. The cerebellar nuclei are nucleus globosus, nucleus emboliformis, nucleus fastigii, and then from there it ends in vestibulocerebellum. Now let's see the second efferent tract, cerebellovestibular tract, and that begins from the flocculonodular lobe, and even this passes through the inferior cerebellar peduncle of the same side and ends in the vestibular nuclei. That begins from the vestibular nuclei and this ends in the vestibular nucleus. Okay, and from here it divides into medial and lateral vestibulospinal tracts, and they end in the alpha motor neurons of spinal cord. So you can see from flocculonodular lobe through inferior cerebral peduncle of the same side into the vestibular nucleus, and then into medial and lateral vestibulospinal tracts, and finally into spinal cord. The other efferent tract, the fastigiobulbar tract, begins from the fastigial nucleus and passes through the inferior cerebellar peduncle of the same side and ends in the vestibular nucleus and reticular formation. The vestibular nucleus is present in the brainstem and the reticular formation is present in the medulla oblongata. So the brainstem and medulla oblongata. From here through the vestibulospinal tract. So in the name itself it is there, vestibulospinal tract. So it ends in the spinal cord, that is the alpha motor neurons of spinal cord. And from here through the reticulospinal tract, it ends in the gamma motor neurons of spinal cord. The functions of nucleus, then you have the flocculonodular lobe, or a flocculonodular lobe, and here is the inner ear. This is the inner ear, rough diagram. So now we'll draw the efferent tract first. So we have seen that the efferent tract begins from the vestibular nucleus. So it begins from the vestibular nucleus, crosses to the inferior peduncle of the same side, and ends in the vestigial nucleus, nucleus emboliformis, and nucleus globosus. Okay? And even from the inner ear, the vestibular nucleus in turn receives from the inner ear, so through the scarpa ganglion. So this is the scarpa ganglion. So it receives through the inner ear this way. So this is the first tract, efferent tract, vestibulocerebellar tract. Now let's see the efferent tracts. Very simple. The first tract is the cerebellovestibular tract, right? So it begins from the flocculonodular lobe, and then it crosses through the inferior cerebellar peduncle of the same side. So like this. And then it ends in the vestibular nucleus. From here, it goes as the medial and lateral vestibulospinal tract to end in the alpha motor neurons of the spinal cord. Now coming to the next tract, which is the vestigiobulbar tract. So here this is the vestigial nucleus. So it begins from the vestigial nucleus and passes through the inferior cerebellar peduncle of the same side and ends in the same vestibular nucleus. And from here it passes to the inferior cerebellar peduncle of the same side into the vestibular nucleus, and another one, it passes as the vestibulospinal tract. So the same as this, actually, okay, the same as this vestibulospinal tract, and the other one as the reticulospinal tract. I hope it isn't messy here. Very simple. It is beginning from the vestigial nucleus, passes through the inferior cerebellar peduncle of the same side. Okay, more. And from here, it ends in the vestibular nucleus and goes as vestibulospinal tract. The other one is the reticulospinal tract, which ends in the gamma motor neurons of the spinal cord. Let's quickly revise. We have seen the efferent tracts beginning from the vestibular nucleus, passing to the inferior cerebellar of the same side and ending in the cerebellar nuclei. And then from the inner ear vestibular apparatus, you have the fibers coming to the vestibular division of cochlear nerve, 8th cranial nerve, passing through the scarpa ganglion and ending in the vestibular nucleus. Coming to the efferent tracts, the first efferent tract we saw was the cerebellovestibular tract, which begins from the flocculonodular lobe, passes through the inferior peduncle of the same side and ends in the vestibular nucleus. And then continues as the medial and lateral vestibulospinal tracts. Coming to the vestigiobulbar tract, beginning from the vestigial nucleus and then passing through the inferior cerebellar peduncle of the same side, ending as reticulospinal tract and